Welcome to the ENT channel. I'm host Dr. Ajay Jain. I'm an otolaryngologist currently in practice at New Delhi. I'm here to tell you about the ruptured eardrum. Ruptured eardrums comes as a shock because either someone has hit you or you have injured your eardrum yourself by Q-tip. Sometimes it happens because of some blast injury or very loud noise, and this eardrum sometimes get ruptured because of some act done by your very close one like your hubby or your spouse. So eardrum means your hearing, and once your eardrum ruptures you tend to hear less. So you feel like that something is blocked in and its pain lasts for a few days, and then if no infection takes place in few weeks it starts healing. Also depends upon the extent of the injury. Eardrum is great because it has a very huge power of self healing, but depends on few other things like the status of your eustachian tube, the tube connecting your ear and nose, and your tendency to having allergies, cold, other respiratory infections. These infections can cause secondary infection in the ear, or sometimes the person by having no knowledge of ear they tend to put oil, especially Indian people, or some people think that eardrop will help them, but eardrop themselves cause infection in such cases because the space behind the eardrum is a very sterile zone, and if eardrum has ruptured let it be, but no infection should take place for proper healing. The eardrop, when you put it, takes the germs from the outer ear and bring to the middle ear. So the golden rule is if your eardrum has ruptured, you should not put anything into the ear, including eardrops, oil, or any other medicine. Second golden rule is for appropriate healing of the eardrum, you should prevent all sort of infection. You should isolate yourself from the crowd. You should wash your hand. You can use the mask to prevent cross infection or airborne infection, and you should take utmost precautions with your personal hygiene. While taking bath, you should use something to plug your ear so that water don't enter to the ear. You should visit your ENT doctor who will document the extent of the injury, will also ask you to get your audiometry done. Why audiometry? Because eardrum injury alone causes around mild conductive hearing loss, which is in 25 to 40 decibel range. But suppose beside eardrum, if ossicles, malleus, incus, stapes, three small bones which amplify the sound from the eardrum to the inner ear gets injured, then the hearing loss would be larger. Sometimes the shock waves get transferred through these ossicles to inner ear, resulting in a nerve deafness also, which is known as concussion injury to the inner ear. In such cases, concussion injury, we give steroids to recover the hearing loss. If steroids are not given in the acute phase of the injury, then hearing loss may never recover back. So audiometry is must in all the cases of ruptured eardrum. So just to cross check whether infection is taking place, not taking place, it's ideal to visit your ENT doctor every week, which he will document the extent of the recovery. In the first 2 weeks, nothing much takes place, only the clots organizes, margins start becoming more well defined, and you just get you're trying to overcome your shock by some your means. But after say 2 weeks are over and no infection takes place, eardrum start healing, you tend to hear better, you are trying to adjust with your environment and getting used to your visit to the physician. Now we see complete healing in most of the cases in 6 to 8 weeks. In my experience, more than 90% and sometimes even up to 99% most of the eardrum injury heals, provided you don't have weak eardrum because of your otitis media or middle ear infection in your childhood. And children in general, their eardrum heal very fast. Children have a great power of healing. The older you are, chances are less that your eardrum will heal, but children they recover superbly. If you have any other illness like diabetes, hypertension, any kidney problem, or any other illness in your body, then the chances are that the eardrum complete healing will not take place. So, ruptured eardrum is actually an emergency which should be dealt with due importance, and the person who has caused such injury is liable for grievous hurt because it's a serious bodily injury. So he is liable for punishment. In India, it's up to 7 years, which is known as grievous hurt. Suppose eardrum do not heal or does not show significant improvement, then it's still better to wait for 3 to 6 months or even up to 1 year. Maybe it heals, but if it doesn't heal, then the person has to go for surgery of the repair of the eardrum, which is known as meningeoplasty. And if ossicles are also damaged, this is known as tympanoplasty, where ossicles are also repaired. In general, the results of meningeoplasty are really good, provided the eardrum have been dry and no infection has taken place ever before. They show excellent results, no doubt. So I'm closing this video here. If you have any question, please put in the comment box. I'll try to answer it as soon as possible to the honest answer or from the best of my knowledge and experience. If you have liked this small information, please give it a thumbs up and do subscribe to the channel for future updates. Thank you.